Thanks for joining us for our October version of Provider Convening. I'm Mark Conajani. I use the he, him pronouns. I am the Division Director for Statewide Programs, Technical Assistance, and Innovation here at the BHA. You can see the agenda that we have. And, we've got a lot of exciting things to talk about. So I'll be updating everyone on some org chart change for the BHA. Mariana Sears is going to talk about ASAM 4.0 from our licensing and designation team. We're going to have a presentation from Chloe about 988 Colorado and our technology and data analytics. And tell me TADA is not a fun way to refer to them. We're going to have Alex, Jumana, and Shapu talk to us about our client care search, own path profile, and provider user research. Please.
Hi, everyone. I'm Jill Davis, she, her. I'm with Statewide Programs as a program assistant. Today, our ASL interpreters will be Stacy Riley and Audrey Reyna. During the event, you can spotlight our ASL interpreters so they will appear larger on your screen. You have the ability to change your view at any time. In the upper right-hand corner of your screen is a view button. You can use this to toggle between speaker view and gallery view. You can also hover over the right corner of the ASL interpreter video and select pin if you would like to see them large on your screen. We are expecting a larger audience, so therefore everyone has been muted to reduce background noise. Make sure you're muted when you're not speaking. If you have a question throughout the presentation, please put your question in the chat, or you can use Zoom's raise hand feature. Questions will be addressed by the chat moderator, Melissa Morales, when it's appropriate, and our presenters will take questions at the end of each presentation. If you have the opportunity to speak, we kindly ask that you introduce yourself and your agency. All links will be shared in chat and files will be shared in the chat at the end of the meeting and should be available 3 to 5 days in 3 to 5 days on the BHA website, along with the recording of today's meeting. This QR code on the slide will take you to a provider convening feedback survey. We will share it again at the end of the presentation, and please consider sharing your feedback with us to ensure we are bringing relevant information to these meetings. Next, we have Webster, who's going to tell us about the purpose of today's meeting.
Good afternoon, all, and welcome, and thank you for joining us. The BHA's statewide programs team will be hosting these bi-monthly convenings and discussing information and updates relating to provider services. We'll also be providing and inviting opportunities for ongoing engagement and provider contributions in these meetings. Again, the meeting will be recorded and posted and published on the website. We want to make sure that we thank you for joining us in our mission to co-create a people-first behavioral health system that meets the needs of all people in Colorado. Mark?
Thanks, Webster. I just want to be able to introduce the executive leadership team at BHA. I think we have Kelly Causey joining us today, but our commissioner is Danette Smith. We have a new chief strategic officer, Aisha Russo. We're very excited to have Dr. Russo join our team. And Aaron Wester is our deputy commissioner of Adult Continuum. Kelly, are you here and able to say hello?
I am here. Thanks, Mark. Thank you to everyone who's joining us today. Really appreciate your involvement in today's meeting and look forward to continuing to work with you.
Great. Thank you, Kelly. And I want to introduce the people who help put this together every other month. as I mentioned, I'm the statewide program division director. We have Danielle Culp, director of statewide programs, process, and justice involvement. Paul Barnett, director of child, youth, and family behavioral health. Valerie Resendez and Carrie Bolter, our co-interim adult treatment and recovery directors. If they are here, feel free to give a thumbs up, say hello. All right, I gave the appropriate amount of time for people to look for a mute button. So now I'll move on and present our provider convening team. Big thanks to Jill, who you've already heard from, Melissa Morales, Sammy Warner, Shane Oram, and Webster Hendricks, who you've heard from as well. These people keep people like me on task, so I'm very grateful for them. And they also help work with all of our presenters to make sure that they've got the information they need and we have it ready for today. So I wanted to give everybody an update. This is a very high level look at the BHA's org chart. As most of you know, the Behavioral Health Administration is a little over 2 years old. While we are still officially housed within the Colorado Department of Human Services, our commissioner is cabinet level. Commissioner Smith serves on the cabinet and reports to the governor. What we're doing currently is we're really looking, the commissioner wants to flatten the org chart to make sure, as we have grown with lots of different divisions, making sure that we are working as one and working in a coordinated way. So we have our new Chief Strategic Officer, you can see up in the left-hand side. Then we also have, we will be hiring a Chief Medical Officer. Most of you know that we're going to learn more about 988. Colorado set up a 988 enterprise board that we are working on an agreement between that enterprise board and BHA so that the staff, many of whom are funded by 988 that are already here, including Chloe, who you will hear from, setting up that structure so that there'll be an in-house 988 manager or director position that will report to the commissioner and obviously be responsive to that 988 enterprise board. We have a deputy commissioner of adult continuum, Aaron Wester, and within that, we've got a division director for health IT, Janelle. We've got division director for BOSSOs, which is to be determined. Most people saw that we have identified the winners for our BOSSO RFP. We're excited to start working on contracts with them. And so we're going to have a division that's solely focused on managing those BOSSO contracts. And then there's me, division director of statewide programs. Next, we have Deputy Commissioner of Administration that'll oversee our finance. We're in the recruitment process for that position. We have a Director of Program Policy, which is also we're recruiting for. We have a Deputy Commissioner of Child, Youth, and Youth Continuum, Kelly Kazi. And again, part of the shift in this org chart is really wanting to have our two deputy commissioners be laser focused on both the adult continuum of services and the children's continuum of services. So Kelly previously had lots of other parts of the organization that are now going to be reporting to Aisha Russo. And you can see those strategic initiatives, strategic project manager, and then our division director for strategy, planning, and engagement, Megan Shelton. So Kelly has is going to have the director of division of children and youth, child, youth, and family affairs liaison, and then still having workforce. Our director of workforce training and organizational development, Lisa Bader-Weinberg, is still reporting to Kelly. Then we have a division director of legislative and government affairs, Ryan Templeton. Many of you are very familiar with Ryan. And then we have a chief communications officer. Allie Elliott is in that interim role, and she's been fantastic. We're going to have an advisor of operations to the commissioner position that will be filled. And then our chief people officer. And again, that's really supporting our HR processes. And we'll have a director of equity diversity and inclusion, and our business manager, Sabrina, who's already here, that will report to that position. So you can see we've, how we're being structured, and that we have lots of opportunities. So spread the word. BHA really wants to get the best qualified people to help partner with you and partner with communities to build a behavioral system that's really going to meet the needs of all Coloradans. With this, I would like to introduce Mariana Sears, who will talk to you about ASAM criteria 4th edition updates and what it means for you. Mariana.
Awesome. Thank you, Mark, and good afternoon, Colorado. So yeah, my name is Mariana Sears. Pronouns are she, her. I am with the Safety Net. I'm a Safety Net licensing manager with the licensing and designation team. So I want to start this update around the ASAM transition by giving a bit of a report out of what has occurred since the last provider convening when we met a few months ago. So on a system level, we have requested support from national entities that have offered to help with this transition process. So there is a state collaborative group that we have requested to be a part of that is sponsored by NASADAD, the National Association of State Alcohol and Drug Abuse Directors, to help with implementation of ASAM 4. So we're requesting to be a part of that. And we've also connected with Hazelden Betty Ford, who is the sole distributor of the ASAM criteria and also provides a lot of training and resources around the ASAM criteria. So kind of on that larger system level, we are asking for help to make sure that we make this transition successfully. Zooming in on the state level, a lot of our efforts right now are on developing and spreading awareness of this transition that will be coming our way in the next couple of years. We're going to talk through on the next slide our transition timeline. And then also before my presentation time is up, we're going to talk about a one-pager that we have developed and will release today that will help to spread awareness around this transition. And then also we've continued some efforts to build out the withdrawal management focused work group that we've talked about at the last few provider convenings. And we'll talk about what that looks like here in a couple slides as well. Okay, so this slide is going to look a little bit backwards, and that is intentional. So as you can see, we're actually going to have it start filling from our end goal. The finish line is where it's going to start, and then we're going to work our way backwards to make sure to provide a good understanding of the timeline and parameters we're working within. So our timeline for full alignment as a state to be fully aligned with the 4th edition of the ASAM criteria is July 1st of 2026. This means all of our funding mechanisms need to be in place. Our BHA involved licenses will only have endorsements that are available that are in alignment with the 4th edition of ASAM criteria. Moving backwards from there, oh, sorry, I'm getting a message that my sound is not great. I'm going to try to lean in a little bit, and please let me know if it's not getting any better. So one thing we would like to do in order to support this aligned provider rule is follow the same process that we were able to do with our updated provider rules this year. We're looking to have the rules take effect on January 1st of 2026 and request that a delayed enforcement period is considered as part of that aligned provider rule. This allows a bit of a softer lead up into full compliance with that provider rule, and also allows for us to provide more technical support for those first 6 months before we are expected to be in full alignment as a state. So then working our way back from there, in order to have the aligned provider rules take effect January 1st of 2026 with that delayed enforcement period, that means we need to be presenting to the State Board of Human Services for our full rule promulgation process in the fall of 2025. This will be a traditional rule process, and so that involves the 2 reads at the State Board of Human Services, a traditional public comment and response period, and so our goal is to be there by the fall of 2025. Moving back from there, our next target to highlight is really July 1st of 2025. This is an exciting date for a number of reasons. BOSOs will be active as of that date, but connecting it back to the ASAM transition timeline we're talking about here, this is really important because it means we're 1 year away from needing to be in full alignment. So we will be actively working on ensuring that funding is in alignment, really focusing in on how this will work for our BHA involved licenses, which are a 1 year term. So that's an important date for us. And moving back one more step, that means that in order to hold to this timeline, we need to be actively stakeholdering in the spring of 2025. This will be a several month-long process. The plan is to do multiple engagement options as have been requested by stakeholders, virtual, in person, a work group, at least one work group. So this is something that we're targeting to make sure the majority of the stakeholdering will be coming this spring. And then going one step back, which leads into where we are today, right? Fall of 2024, leading into winter and then spring of next year. This is really our opportunity to complete the base foundational work to make sure that we'll be supported in making this transition in alignment with this timeline. Right now, we are working with the withdrawal management focused work group, which we'll talk about in a minute. This is our opportunity to look at statute and other funding mechanisms, other barriers that might be in place to have an opportunity to address them within this timeline so that our system and our state will be set up to support a seamless transition into this 4th edition of ASAM. So I'm going to try real quick. I'm going to try to pop into the chat a PDF version of this proposed timeline in case that would be helpful. I have not done that with Zoom before, so please, I hope it works. And if it doesn't, let me know and we can figure out a way to get you the information outside of the Zoom call. Next slide, please. So one thing to highlight with this transition, the impact is not going to be necessarily equal across all providers in the state. There are some transitions in the 4th edition of ASAM that are applicable to all, and then there are some that are varied impact depending on the services that are provided. So a couple things to highlight that are applicable to all providers that we'll look forward to moving into alignment with. Practical shifts. Assessment standards are going to look a little bit different in the 4th edition of ASAM. We have some more kind of holistic and person-centered shifts that will be applicable to everyone as well. Programs will need to become co-occurring capable, focus in on harm reduction and promote recovery supports run by peer support professionals. And also we can look forward to having a new level of care, which is for long-term remission, which is a very important level of care that we have not had up until this point. So I'm looking forward to that. Then moving into services that, thank you. As far as anticipated impact based off of services that are provided, on the lower end of the impact scale, we're looking for outpatient, including high intensity outpatient services. There's not a huge shift that we're expecting to see between our current ASAM edition and the 4th edition for that particular provider type. So minimal impact expected there. Our priority impacts are really going to lie right now within residential and withdrawal management programming. And this is because in the 4th edition of ASAM, there is no standalone withdrawal management type service. It becomes embedded within other levels of care. In this case, residential programming is expected to become withdrawal management capable, meaning if somebody needs to undergo withdrawal management services and they're in a residential program, they would be kept in-house for that service to occur. On the residential side, clinical hours are going to change, daily structure requirements. So there are a number of changes that we'll want to work through as a state for that provider type. And then again, leading into the last bullet point, withdrawal management, as mentioned, that becomes embedded within another level of care, which is a challenge that we'll need to address together. Next slide, please. Okay, so then leading into our withdrawal management focused work group. This has been a build-up for several months. The ask was for an action-oriented, time-limited work group that is focused on transition options for withdrawal management involved providers. We cast a wide net, asking to see who would be interested in being part of this discussion, and received over 40 responses to be in attendance or at least connected with this process, which is fantastic. As expected, when you cast a wide net, we have a variety of provider types and individuals who are interested in being part of this process. And so now we're in that place of kind of walking the line of how do we make sure it is a functional group moving forward so we can be action oriented and making sure we have the right number of people and the right provider lens at the table at the right time. So part of what we're doing right now is making sure that we can improve our communication of what our goals are for the immediate future. In October 22nd from 12 to 1:30 via Zoom is when our next withdrawal management work group is meant to meet. And it is going to be focused on the evolution of withdrawal management services. Really that emphasis is 3.2 withdrawal managements. That's one of our important focus right now. Invitations, some guiding questions and session information was sent out yesterday to individuals and providers who have requested to be part of this effort. And so we ask that if you had asked to be a part of this effort to please read that information that was sent and see if that is of interest to you right now for that initial work group. We do want to highlight that we anticipate there'll be targeted discussions around this also in November and December. So next week is not the end all be all. There'll be multiple discussions around this and work going forward. Next slide, please. So the all important, what can providers do? Our biggest ask, if you take anything away from today, is please be curious and look into the 4th edition of ASAM. Start looking at it now. ASAM.org has a number of resources that are really helpful to start to understand what some of these changes look like. Some of them are for a fee, right? You can certainly purchase the 4th edition of ASAM, get a subscription for that. They have trainings that you can attend with a live person to work through some of the questions that you have. But they do have a lot of resources that are free. Implementation resources, visual aids. They have a 300-slide training that you can download, including speaker's notes to really walk you through what this looks like. So please visit that website and just start educating yourself around what this 4th edition looks like so that you're ready to work with us on this implementation going forward. The next thing, spreading awareness to your provider networks in the community at large. I'm going to go ahead and put something else into the chat, assuming that first attempt worked. This is the one-pager that we have put together to help start that discussion and to have a visual resource that can be sent out to anybody and everybody who might be interested as a starting point. When you look at this one-pager, it goes through the what, the why, the when, gives a high-level expectation of the volumes that are anticipated for the 4th edition of ASAM, and highlight some notable changes and how this will overlap a little bit with the timeline for other rule processes that are happening with the BHA. Please keep in mind this is meant to speak to a larger audience, so it doesn't go into all of the detail that you may want for specific needs or provider types, but this is our starter point for that larger spreading of awareness. Going into the withdrawal management focused work group, again, this is not something that has a link available on the website right now. we're really trying to figure out how to prioritize getting in those directly impacted providers for these next few months to really do a lot of that foundational work. So if you are a 3.2 in particular withdrawal management agency or provider, and you have not connected with us yet, please consider connecting and we'll get you in there. The email address to connect to is listed under more engagement opportunities, CDHS_BHA role feedback at state.co.us. And again, if next Tuesday does not work for you, that's okay. We're going to have other opportunities as well, but we do want to connect with you sooner rather than later. And either way, our plan is to send recaps via email to all who requested involvement. So if you look at this and say 3.2 focus right now is not where I'm at, but I'm still interested in keeping my finger on the pulse, the plan is still to send out those email updates to keep everyone who's interested in the loop. I think that is all that I had to present today, unless there are any questions.
Yeah, I definitely want to open it up for questions. Thank you, Mariana. This is a big change that's coming to Colorado. It's obviously happening all over because ASAM really sets the standard. It's what Medicaid uses to be able to approve funding for substance use services. So it's a pretty significant change to our system and one we're going to navigate together. Thank you so much, Mariana. Lots of opportunities to engage. Please do take advantage of this. We need providers to help participate in this process so that we can do this as effectively as we can. All right, and with that, with no questions, I will.
Okay, I'm sorry, this is Kelly. I see a hand up.
Oh, good. I'm sorry.
Stacy.
That's great. Thank you. Yeah. So this is Stacy Samaro. I am with Crossroads Turning Points. Mariana, one of the things I was kind of wondering, I know we kind of chatted a little bit yesterday when you dropped by, but for next week's meeting, I'm wondering if kind of in preparation, like maybe you could send out almost like a Google document or spreadsheet that kind of has some of those like bullet point kind of big discussion areas that maybe we're wanting to start with, where people can kind of start putting some of those ideas or some of those things in there. So that way we maybe kind of have a starting point for like that meeting next week of like, hey, these are kind of some things that have already come up. Let's kind of expand on it, talk about it some more, maybe do some problem solving stuff kind of from that place. That was my only comment though.
Absolutely. Thank you, Stacy. Yeah, so there is a reference that was meant to go with that as part of those guided questions to get started, but that is this close to being ready, and it fits more along with what you're saying there. So that should be out hopefully by the end of today is my hope, if not before the week is out. So yes, thank you for the suggestion.
Okay, now I see a thumbs up, no other hands up. Thank you, Kelly, for catching that. And thanks, Stacy.
Thank you.
All right, now I'll hand it over to Chloe, who's going to talk about 988 Colorado.
Thank you, Mark. Hi, everyone. My name is Chloe Rico. I use she, her pronouns. I am the marketing and outreach specialist here at BHA and work very closely on the 988 program. Kelly Bowman could not be here. However, we put her email at the end. So if you have any questions or any follow-up, I can try to answer them, or you can follow up with Kelly herself. We do have some really exciting updates on geo-routing. I know a lot of you all have had those questions. It's statewide, it's nationwide. So we have some great updates to share. As of September 17th, the first phase of geo-routing went live. That includes Verizon and T-Mobile. So right now, as of now, Verizon and T-Mobile both route 988 calls by cell tower, which allows the connection to individuals to their closest contact center, which is awesome. I know people have had a lot of concerns about what that looks like and making sure that people can get connected to local resources, not dependent on their area code. So we're really excited about that. And many of our team members are actually flying home from Arizona today. They were at the big Crisis Con conference alongside our contact center, Solari. And SAMHSA made the update, or gave the update, that AT&T is expected to implement geo-routing by the end of 2024. So we're very hopeful that will happen. They have not announced a timeline to implement geo-routing for 988 web-based calls, texts, or chats. However, we're hopeful that we'll continue to get updates and also share them out with you. We continue to recognize the importance of geo-routing and what that means for our communities, especially in all the research we did. That continued to be something really important and valuable for the people of Colorado. So we will continue to provide updates, and we're really encouraged by the progress, especially since we're only in the first 2 years of 988 operations. So we will continue to keep you updated as we get updates. So stay tuned for that. Next slide, please. Here are some we wanted to highlight, and we're going to try to do this every provider convening, to share how people are talking about 988 in the news, especially as it relates to Colorado, if you want to share them out. We do have, as Mark mentioned, we are governed by a 988 Enterprise Board. I actually work very closely with them and funded by them. And they're a great group of humans throughout the state. And they have been taking interviews for us. Kelly Bowman, our program manager, also took an interview. We were at the Colorado Rockies game and did a corporate sponsorship with them to raise awareness of 988. I don't know if anyone has heard this yet, but when we did our research last year, awareness of 988 was at 5%. And we'll be doing additional research coming next year at the beginning of the year and kind of seeing how's the media campaign going, how are people perceiving our marketing, as well as really intentional community engagement work. We just partnered with 40 different organizations throughout the state with our marketing agency partner to really have conversations around how are they talking about mental health, what are their concerns, just around connection to behavioral health services, as well as 988 specific. So we're really excited to continue that work, continue to build those relationships, especially in many of our priority population areas, and really continuing those conversations as we build out this campaign. So these are some of those articles. Shane is so wonderful and sharing the links in the chat. So if you want to take a look at them, please do. And then next slide, please. Oh, there we go. This, as I think we mentioned last provider convening, we have several digital assets as well as print assets available for you all to share 988 within your communities. If you want to reach out to Kelly Bowman, this is her contact information. But if you visit our website and both of these links, you will have access to a plethora of assets, including social media posts, boilerplates, an extensive FAQ document, as well as graphics and logos that you can share. If we can ever be helpful or answer any of your questions, if you get any feedback in community, we do want to hear it. So please share it with us and we can figure out what's next. So we really appreciate you all and your support in raising awareness of 988. And we also just wanted to mention also doing a lot of work with the Colorado Department of Education and making sure that we are not missing out on the youth populations as well, including all the students within the public and private schools across the state. So it's a big priority for us right now, and we're excited to see what's to come. So thank you all.
Thanks, Chloe. Any questions for Chloe about 988? And Kelly, I'm waiting to look for hands now. I'm being good. All right.
No questions in the chat.
Fantastic. Okay, thank you, Chloe, so much. With that, I'm going to hand it over to Alex Mayo from our technology and data analytics team, who is going to talk about the client care search. Alex, you're up.
Awesome. Thanks, Mark. Hi, everyone. Very nice to be here. My name is Alex Mayo. I use he, him pronouns, and I'm a product manager supporting client care search and central registry. I do want to caveat up front that if you attend our technology office hours, some of this content might feel familiar, but I think it is important to share our learnings thus far. Next slide, please. So want to provide an overview of what is client care search. And it is a system for inpatient and residential behavioral health providers to track their bed availability. And we're using that availability to help care navigators find information for client placements. So it's not just a data gathering tool, but it's meant to help facilitate care navigation. Where does this come from? It roots in legislation from Colorado Revised Statute 2760, 104.5, and it's for inpatient and residential behavioral health facilities, state agency care coordination teams, and intermediary organizations. Our design for client care search was informed with a lot of your feedback and engaging with providers. So we've, over the course of the developments, talked with over 100 providers, 7 peer states, 5 peer agencies, and innumerable BHA staff across every division. We also try to work in the open, so our research to inform this work is available on BHA's For Providers website. For client care search, we do like to root our work in user stories. So on the right here is a user story for behavioral health care navigator. And the intent is we want to help support them when they need to place a client in an appropriate care setting in a timely manner to ensure that they receive the care that they need. On the next slide, we'll briefly cover the history here. So the legislation for what was called bed tracking system in legislation was passed in 2019. And then in 2022, the Colorado Digital Service partnered with BHA to help execute against that legislative requirement. We spent the last couple years in design and build, and very happy to say we launched in June of 2024 and have onboarded about 100 provider organizations. I see some familiar names on this call, so probably not news to many. And next, we've launched what we call the minimum viable product, the MVP, and we're looking to build out some more advanced functionality, namely referrals functionality in client care search. On the next slide, we'll just kind of go into a little bit more detail on what features are in client care search. So on the left is functionality that's available today. So there's 2 main activities. There's one where providers, inpatient and residential providers, have the ability to update their bed availability. And this helps show directional availability for care navigators to find care. Right now, we're kind of in the early stages, so we haven't increased the user base beyond those updating bed availability, but that is the goal. And that search beds is a directory where you can search for all inpatient residential providers that are licensed by the BHA and utilize availability information to inform care navigation decisions. In the future, as I hinted at, we are looking to build more embedded referrals functionality, and we have started piloting this in September, so you may have heard some requests to participate. And this will be ongoing. We are working to get feedback and iterate to make this right before launching it broadly. We'll just close with a foreshadow to Xiaopu's presentation in a couple minutes on a research participant pool. So if you're interested in learning more or perhaps participating in piloting this advanced functionality in client care search, engaging in the research participant pool is a great way to do so. That's all for me, but happy to answer any questions you may have.
Yeah, any questions, Alex? This is very exciting. I just think of the role this can play for some of those big organizations, whether they be Rays or Bossos or just BHA with our care coordination team or our IC team being able to more quickly identify where we've got available capacity to refer people so that we don't spend a lot of time outreaching programs that we know are full. This could really increase efficiency if we can, and you've partnered really well with providers to make it useful for them. But love to hear if there's questions or comments from people that just heard Alex share.
Stacy Samaro in the chat asked, are there plans for an expansion to make the referral for OP services too?
Long story short is we are still figuring out the best way to roll out referrals. I think that is definitely something we're going to be considering, but it'll likely be a staged release. So and I don't have a solid answer on when we'll release referrals to which provider groups at this time. But great question, Stacy. Happy to follow up offline as well.
Any other questions? And thank you, Melissa, for monitoring the chat. Okay, Alex, you're off the hook. Next, I will Jumana Aryan will talk about OwnPath profile. Jumana, you're up.
Awesome, thank you. Hi, everyone. My name is Jumana Aryan. I use she, her pronouns, and I am the product manager for the OwnPath Care Directory and OwnPath Profile products here at the BHA. So today specifically, I wanted to talk to you about a new tool that we're developing called OwnPath Profile. The purpose of this tool, the goal of it is to expand the quality and volume of data that we get on behavioral health providers like you. So what we mean by this is we want to increase how much information we get on facilities, but also how accurate and up to date that information is. So this is going to be an online tool where you'll be able to update the information of your facility, things like hours of operation, populations you serve, description of your facility, things like that. And this will automatically update your profile on the OwnPath Care Directory. For those of you who are unfamiliar, the OwnPath Care Directory is a list of behavioral health providers. As a BHA licensed provider, you are on that directory. You're on that directory already. So if we think about the users of this OwnPath profile tool, it doesn't need to be anyone in charge of licensing or anyone that works with the ladder system, but it can be up to your facility who you would like to be the users, but we do recommend that it would be someone who's a front desk staff, administrative staff, someone who would know this high level information on your facility. And if we think about the different types of providers who will be using it, we first want to open it up to you all as behavioral health, as BHA licensed providers, since you all are already on OwnPath. But after that, then we will start to expand into other provider groups and providers specifically not licensed by the BHA. So if we think about other providers who accept Medicaid, individual clinicians and therapists, for example, those in private practices, those are going to be the type of providers we add next. And next, I wanted to talk about the impact of the system. So if we go to the next slide, there's a few different key areas that I wanted to point out specifically. The first is that this is going to be a way for us to expand access to care. So it'll be able to expand the amount of data we display to people who are seeking care on the OwnPath Care Directory, because we'll be able to collect more data from you on what services your facility offers and what your facility is like. So all the data that we collect in the system will be displayed on the OwnPath Care Directory. And it's really important, because it's going to be used by people who are seeking care, that we collect the data as accurately as possible and as much as possible in order to give people who are seeking care like the most amount of information possible so they can find a provider that meets their needs. And secondly, we want to empower you all as providers. We want to make it accessible for you to access your data and update it in real time on your own in a portal that you can access at any time. So any changes that you make to the OwnPath profile tool will show up directly in real time onto the OwnPath Care Directory. So we know that things may constantly be changing at your facility, and this will be a way for you all to have control of how your facility is displayed to the public, and you can update it on your own. Thirdly, something else that we care about here at the BHA is supporting backend data connections. So we know that you already submit data to the BHA, and wherever possible, what we're going to be doing is making sure that we reduce that burden on you so that you have one place to update your data, and then us on the backend will send that data to the appropriate systems so you don't have to update it in multiple places. And then lastly, more of just like a larger scale thing. We know that behavioral health care, we don't have as much information as on behavioral health providers. So we want to start to expand that infrastructure so that it can meet the needs across the state. And then if we look next, I want to talk a little bit about onboarding and kind of the timeline that you can expect from us. So tentatively, from now until about the end of the year, we're still going to be working on system development and testing to make sure that the system works appropriately. And in January, as BHA providers, you can expect an introductory email. This will basically introduce the system, what you can expect from it. And then in February is when we expect this onboarding to be. So we'll have the dedicated office hours for support where you can drop in, ask any questions or clarifications that you have about how to use the system. And then in March, we'll be still having those office hours, collecting feedback. And after March is when we'll start to think about onboarding non-BHA providers. So that's the overall update on OwnPath profile. Throughout this time, we'll still give updates during the provider technology office hours if anyone goes to those. And the last thing I wanted to talk about is a feedback opportunity that we actually have. We are working to expand the type of services and how the information that's displayed on the OwnPath Care Directory. So we would love it if you all would take a few minutes to fill out this survey that asks about the type of care that you offer at your facility. And these are services that are not related to your BHA license. Again, a few notes, and taking the survey won't impact your license. It'll only be used for us as we are making sure what information we collect from you through this system and that we communicate it effectively to the public. And that is it for me on OwnPath profile.
Thanks, Jumana. Any questions? And maybe I have one just to make sure I understand this last part. We know there's lots of providers in the behavioral health space that maybe aren't offering clinical services that are licensed by BHA. Example, recovery housing that might be, CAR certified, or recovery community organizations doing a variety of different types of peer support services. Are those the types of organizations that you're hoping will take advantage of this survey and reach out?
Yeah, that would be great. So in this survey, we were looking for things like, do you specialize in treating anxiety and depression or bipolar disorder, things like that. But also we have options in there for you to add any notes about specific things that we haven't specifically asked. So any feedback is appreciated, and we'll be reviewing all of it.
Okay, that's great. And I think that helped a lot too, because our license for a clinical agency wouldn't necessarily say that they specialize in a certain type of care. So being able to identify that they do a lot of work with post-traumatic stress disorder or something like that is very helpful information that can help people find the care they want through this OwnPath profile system. So that's very helpful. Thank you for that clarification. All right. Any other questions for Jumana?
Nothing in the chat.
All right. Xiaopu, you are next to talk about ongoing provider user research.
All right, thank you so much. Hi, everyone. I'm Xiaopu Feng, and my pronouns are she and her. I'm a digital advisor with the Technology and Data Division at BHA. Part of the essence of what we do is that we always want to be striving to uphold the value of co-creation by always designing with the end users of our technologies. In that we want to be regularly engaging with providers like yourselves so that we can get feedback early and also often. So to that end, we're introducing a research participant pool of providers. If you are interested in shaping our technology, which is also ultimately your technology, we invite you to sign up and join the research pool. By joining, you are only agreeing to receive email notifications of upcoming research projects. You are not actually committing to participate in any research. You'll just be notified. So as new research opportunities do come up, information about each project will be made available, including where the session is held, the time commitment involved, and the general task that you would be asked to do, and the researcher that you could contact if you had any questions or concerns about your participation. You can always request to be deleted from this research participant pool at any time for any reason by emailing the email address on this slide. If you can please help us build this research pool by sharing the sign-up form with others who you think would be interested, we would be forever grateful. We would love to have the opportunity to engage with you should you be interested and available. If you have any questions, please don't hesitate to ask either in chat or by emailing us. We thank you in advance for your interest and support.
We wanted to make sure everyone knows about some different, the next meeting that we have is December 19th. You can check it out on the calendar. We've got the fancy QR codes where we have a Zoom survey. We appreciate any feedback that you want to give us. Did you really, I think Jill really wanted me to take a little bit more time for people to maybe hit that previous QR code because it is an opportunity to give us feedback as well as make suggestions of what are the topics that you want us to share and to bring to this meeting. Lots of ways to stay connected with BHA, take advantage of them. We got lots of exciting stuff coming. Like we said, we're really excited to start working with our bossos and get them under contract so that they can start working in January and have a July 1 launch with them. So very excited, and we'll see you next time. Thank you.